the Evergreen Media Network Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Welcome to the Preventus podcast, everybody, where we talk about all things health and wellness with a focus on prevention. I am your host, Dr. Felice Haake. I'm super excited today to share with you a wonderful episode. I'm bringing back Melissa Meadows. Thank you so much for coming back. I don't know if you guys remember, but we did a 3-series with Melissa. Melissa is an aesthetic nurse practitioner who I am very honored to work with pretty much every day at RBI. And we're doing an episode really on kind of summer aesthetics. And what do I mean by that? So most of the time when you're thinking about your aesthetic goals, your treatment plans, a lot of people will put the summer on the back burner, meaning we really can't go out into the sun with the laser. And summer's really supposed to be about vacations and
outdoor
sunshine.
activity.
Yeah. And if you're in Florida, it's pretty much all year round. So with that being said, you think to yourself, and most people think to themselves who do, have aesthetic treatments as their goals, will think, well, I don't really have the ability to do anything in the summer, and that's untrue. And so this episode, we're really going to kind of talk about some novel devices and things that you can do for skin tightening and still kind of accomplishing your aesthetic goals and being able to go out into the
Be
sun.
social.
Exactly. Yeah. So.
Absolutely. So thanks for having me back again.
So happy.
We had a little bit of a hiatus.
I know.
Yeah, you look nice and tan.
Thank you. It's fake.
Well, mine is real. And that summer heat in Florida, my goodness, you can't avoid it, and nor should we. But I'm really excited for today's episode because I love everything aesthetics, and it's really important to discuss things that people can do year-round and also during summer, months when you're not able to get those laser treatments, but you're really seeking skin rejuvenation because we're constantly aging, right? So what's going to be something that a patient can do with no downtime and really little avoidance of their everyday activities, such as sun exposure, boating, things like that. So we're going to kind of dive into what we offer specifically at RBI as far as different skin tightening treatments, whether it's ultrasound non-focused versus micro-focused ultrasound, and also what are the latest techniques in the industry that there's out there to offer. So
lead us off. So I think you want to talk a little bit about ultherapy first, correct?
Yeah. So how we're going to kind of set up this episode, I think it's really important for viewers to know because there's so many different devices out there and what's right for each patient. Well, that's really important that you go to a very knowledgeable provider that pairs you with the right device, right? To give you that customized treatment to yield that result. Well, there's different types of technologies for skin tightening in general. We've got radio frequency, we've got ultrasound, and ultrasound actually in 2 different versions. So the most commonly used, it's been out on the market since 2009, is ultherapy. And that's high-def technology. So that's high-intense, micro-focused ultrasound energy.
Okay.
What does that mean to the patient? Well, yes, it'll deliver energy to your tissue to help thicken your skin by producing collagen. Also provides lift and tightening, specific to the face, but really great providers are using it more for off-label uses as well. And we'll dive into some befores and afters there. But it's kind of the technology that's been around. It's tried and true. It's been over 10, 15 years that we've been using this technology. And I'll go through some befores and afters and why we choose that specifically for a patient versus other modalities.
Okay. So do you just need one treatment with this one? Yeah.
So, I think the best way to answer that, because that's the number one question I get from patients, is it one and done? Well, we're always aging. It's like working out, right? I'm like, okay, we've got to your weight goal. We got to maintain it. So there's a maintenance component in anti-aging procedures. So yes, we say one and done with all therapy. However, it's important to get boosters. So I typically recommend this treatment once a year for my patients.
Okay.
I mean, I get one at least, I don't go further than like 15, 16 months without getting an all therapy, because it's just like going to the gym for my face.
Yeah.
It's reboosting my collagen, so it's slowing down my aging process. And it's a very non-invasive way to improve the thickness of your skin.
Yeah.
Everybody's looking for the least invasive, right? We want to be able to walk in somewhere, leave, go grocery shopping, be out in the sun, and not have all of these other, limitations as far as how we improve the look of our skin.
Right.
So when we think of all therapy, this is a ultrasound technology that is called microfocus, because the way it works is a beautiful machine here. You can see the handpiece to the left of it. The beautiful thing about this is it's very operator driven, and I can't say that enough. Whoever's using this, you are in the hands of their skill, okay? And their result and also your pain level is going to be driven by their expertise and their experience with it. But the beautiful thing about this technology is you can actually scan the patient's tissue. So you're delivering energy into that layer of tissue that you're really trying to elicit that collagen production. That's how you manage pain. That's how you dictate the result. If you're driving the energy into bone, it's going to be a painful procedure, right? So it's very operator driven. It typically takes about maybe 30 minutes of numbing. You use a lidocaine topical and then maybe some laughing gas, and you get your patient through the treatment. I've probably done close to 1,000, and I've never had a patient not get through the procedure. Yeah. Now, the results with any skin tightening treatment are never completely immediate, okay? And the way I like to describe it, okay, think of like your collagen as a tightly wound rope, okay, when we're nice and youthful. Well, as we're aging, that rope becomes very unwound, tethered, and kind of starts looking less tight, right? Yeah. Well, when you apply heat to that structure, it immediately recoils, re-strengthens, and starts proliferating. So that's when I'm driving that energy into your tissue. That's what I'm trying to do, is just to re-strengthen your collagen. So the results aren't immediately visible. Okay, you do have to be patient with any skin tightening. They're more visible maybe at about a month later, 3 months later, and that's when we do our follow-ups with patients. We compare their pre and post-treatment photos just to monitor their progress. Okay, I'd love to throw up before and after. So all therapy is FDA approved for face. Okay, so it helps lift jowling, your eyebrows, your neck skin tightening, and it improves fine lines within, your décolleté area, that chest. I use it a lot off-label, okay? A lot of women come in, tell me, I'm experiencing this laxity in my arms. I've got a wedding coming up this year, and I want to wear that sleeveless, beautiful gown. Well, I tell them, you've got to give me time to prep your tissue. I usually start with a little bit of all therapy, which is just that skin tightening with the ultrasound energy. And you can see this patient here. This is just one treatment. I always set them up for realistic expectations, though. I say, I'm probably going to recommend a series of 3. I'm going to bring you back at 4 weeks, which I did with this patient. I say, if you're happy with your level of correction, I'm happy. Yeah. If you want to take it a step further and see more and more, we got to do treatment 2. We got to do 3. Yeah.
So what we're looking at for those listeners who are just listening, and you can see these pictures on YouTube if you go to the Preventus podcast YouTube channel, is a picture of a woman's arm, a before and after, and the arm before looks crepier. That's the term I would use. Yep. And then after looks much smoother. Now, how much time elapsed between the treatment and the second picture?
That's a great question. It was 4 weeks specifically with this case.
It's really amazing.
Typically, I'll treat a patient and I bring them back no earlier than 4 weeks. And then I see them again at 3 months, 6 months, because I always say this is an ongoing improvement, okay? Yeah. And we always forget where we start, okay? Because we look at ourselves every single day and we're like, is it really working? Is it really working? Well, that baseline photo speaks volumes. So once the patient comes back in, they see that, they're typically pretty happy. Now, a lot of the times I will do combination treatment. With that patient specifically, I also injected, after the all therapy, dilute radius, which is a biostimulator filler. It's calcium based. Okay. So it production, basically. If you look even further, I've got a before and after of an abdomen. And this patient, believe it or not, this was taken immediately after treatment.
You can see the redness in the second picture, just redness from the treatment, correct?
Right. Yeah. And a little bit of lumpiness. I promise that all resolves with a warm compress, a nice vigorous massage, and time for the product to integrate into the tissue. Because as I had said, that is dilute radius. That was the step 2 process of this entire treatment plan.
That's incredible.
Immediate correction. Okay, so in her before, you can see that crepiness right above the umbilicus.
Yeah.
And then even above that, you can kind of see where she had some fibrotic tissue. I used all therapy. It took me about 45 minutes to really boost that with ultrasound energy. And then I infused radius, and I take cannula and I kind of subsize that fibrotic tissue. So I kind of loosen up that tethered tissue so it just looks smoother and smoother.
That's quite a result. I mean, she must have been thrilled.
I know.
So that's all old therapy, yes. Okay.
And now let's get to cell sound, which is the latest ultrasound technology. I mean, it's truly, truly innovative technology, okay? So ultrasound, as I've mentioned, has been used in aesthetics, therapeutic, indications for years and years. Well, this machine came out about 2 years ago, and we're, I think, only the 4th or 5th in the country at RBI to carry it. I mean...
Well, I know as far as I know, as it stands now, we're the only ones north of Miami
in
Florida that own one of these. I mean, it's pretty much, it's hit the West Coast. So the West Coast, I don't mean of Florida, I mean of the country.
California.
Yeah, it's, I think there's quite a few over there, Arizona, et cetera. But in Florida, we're one of the only ones. So it's a novel technology. We were blown away by it.
I absolutely love it, and for a multitude of reasons, okay? When we think about skin tightening, okay, how are we generating skin tightening? Is it thermocoagulation? Is it creating an inflammatory response in that patient, in order to elicit proliferation, which is typically the past devices that we've used in the past? Cell sound, why it makes it so revolutionary is it doesn't create injury within the body. So the ultrasound within itself it's deemed non-focused ultrasound energy. And it actually uses like an electrical field. There's these little electrodes that you place over the area. And if we can see in the machine here, there's several different hand pieces as well. But those cords, that attaches to electrodes. And every cellular wall has what we call an impedance, right? It's a protective mechanism. So you can't really drive too much energy into it. Well, when you create an electrical field, it reduces that impedance of that cellular wall. The ultrasound energy penetrates. So it works by not only producing collagen, elastin, angiogenesis, which is revascularization of tissue. You can set it to a setting where it emulsifies fat.
Oh, yeah.
And not only subcutaneous fat, which is that pinchable fat, but visceral.
Which is the dangerous fat.
Ever to go to the depths of visceral fat. So you'll have those men, women that come in, they're like, my God, Melissa, Dr. Haake, I've been working out like crazy. I eat perfectly. Why is this not budging? Well, it's that hard, dense tissue, like a lot of men have. Well, that's visceral fat. And as you had mentioned, that is the
dangerous fat.
Very dangerous fat.
For your health.
One that drives cardiovascular issues, things like that. So the fact that this penetrates visceral on top of subcutaneous, that's why it's so effective. The other thing is it's not creating an injury into the body.
Yeah.
So it's working by a non-inflammatory mechanism.
So it's purely regenerative, which is why it's novel. I mean, is there really anything else that does that?
Not to my knowledge at this point.
Yeah.
Yeah.
So, Cell Sound really blew us away. They came out, I remember the rep came in and showed us some before and after pictures. And one picture really stood out to me. It was a woman. I don't think you have this before and after because we used our own stock photos, correct?
Yes. We'll show some of
It was a
those.
woman who had very, very crepey skin, but she was thin. And that really drew me in because I'm thin. And I really would like my abdominal skin to look tighter. Exactly, after having 3 babies. And so that really blew me away. And so I said to the rep, whose name is Connor, I said, how about this? if you give us a full treatment, because most reps won't, most device companies will give you one treatment and then say, now buy it. And you're like, well, I don't want to buy it yet. I don't know if it really works. And so they said, okay, no problem. You need to block your schedule. We are going to give you guys pretty much a full treatment. And we got close to a full treatment. And so I did my abdomen, you did your back, your side, buttock and
my little banana roll underneath the buttocks.
Yep. And then we had a face model, and all three of us got this treatment, and in 3 days. And I remember just going home, looking in the mirror, and just being blown away by the results. My skin was noticeably tighter. The fat on my belly was, it was half gone. I was really, really, really floored by it. And then that was it. We all became very obsessed. Like, we have to have it. We have to have it. So, and here we are. So, and we've done it on quite a few patients now who have gotten really nice results. And you have pictures of those people.
I do. And one that I want to show you is of an abdomen. And you can see the top photo is her before. The after photo is below. This was a series of 3 treatments.
It's unbelievable.
What I love to point out here is not only the debulking of that subcutaneous fat, okay, and she's post-mom. Her baby is now 10 months. She really struggled with a lot of laxity, and not only the striations, okay, we get stretch marks as that tissue expands. Well, again, you're not dealing with one thing, and there's never one device that fits all, right? Okay, when we think of loose skin post-babies, we're dealing with excess sub-Q fat, potentially, striations, okay, and just that loose crepiness. Well, this is truly a machine that kind of tackles all 3, okay? It will not improve texture in the sense of striations, but what I found in this patient specifically is that since the ultrasound generated such revascularization of that tissue, looks healthier. It's more vibrant. They're getting better nutrients, oxygen to that skin surface. So now I can take her treatment a step further, microneedle to improve that texture, and then, topically layer it with some form of PRP to just further kind of provide skin remodeling.
So you can really take a multifaceted approach.
Completely, yeah.
With different things.
It's pretty awesome. And the other thing I'd like to point out, this is that treatment where there is truly no downtime. You can come in sun exposed, okay, leave, resume your normal activity. In fact, we encourage you to work out, okay? It's not a painful procedure. It's non-invasive. It's not, penetrating the dermis in the fact that it's leaving an injury to it.
Right.
So it's truly just regenerating tissue, and it feels amazing.
Yeah, it's almost too good to be true, because
patients fall asleep.
I was just going to say, we've had patients who were talking to them when we realized, wait a second, she's asleep.
You're like, what?
Because it kind of, the electrodes just feel like a TENS unit. If you've ever experienced that, it's kind of pulling a little bit on the muscle and the skin. And then the actual hand pieces are just kind of a warm, rotating device. It's not painful whatsoever. It almost feels like a massage.
There's no numbing involved. You come in, you have about a 40 to 50 minute appointment, and then you're out the door. Now, this is a treatment that is recommended, especially when we're emulsifying fat or any skin tightening. We want to set the patient up for success.
Yeah.
It's not one and done with this treatment. It is a multitude of treatments. Typically, the protocol is 6.
Yeah.
You do 2 a week. So over a 3-week span, you will see this transformation. And then results are even further generated up to 3 months after treatment.
Yeah, that's the most ideal regimen, correct? But if, let's say we had someone who was out of town who needed to get them done a little faster, we could kind of squeeze them in. We try not to, because it overwhelms the body a little. And then also you can space them out. For someone who's like, I can't get in twice a week, you could do it once a week, and space them out.
Yes, one is better than none, I say.
Exactly.
I even want to look at this as I do all therapy sometimes, where it's a refresher once a year. I just need to reinvigorate your tissue.
Yeah.
We have to start looking at aesthetics and anti-aging as not a Band-Aid onto a symptom. It's preventative. We need to optimize the functioning of your cells, of your fat cells. You had just said, sometimes it overwhelms the body. Well, what does that mean?
Yeah.
So just to get back to that and why we do 2 treatments a week, or we have maybe a 2 to 3 day period in between the sessions, is because how are we emulsifying this fat? Where is it going?
It's got to get out.
Well, your body is using it as fuel. So you've got to give it a period, of time. So you go into that fat burning process, and it's used as energy.
Yeah, it's really amazing. Do we have other pictures? Because it can do the face for face tightening.
Yes, you can see all of the hand pieces. We have a face hand piece, which I love that one because if you're a patient that experiences those herniated fat pads or you have that bulging under eye area, this works beautifully to set it, to emulsify that fat pad and then provide skin tightening as well.
That's amazing.
That's where I'm really seeing it on the face shine. What other pictures do we have? We have, next
topic. Next topic. I love that picture.
Bootylicious results.
Yes,
okay,
this is the booty we're looking at.
Dr. Haake, our messaging is always regenerative medicine. You work with patients to fix hormones, to improve thyroid function, to, prevent your patient to going into diabetic, to that type 2 diabetes transition. That's what you're really great for. I always say beauty is skin deep because you fix the internal things, okay? Now, when we think about aesthetics or just the aging process, it's multifaceted. We talked fat, we talked of loss of collagen. Let's talk of loss of volume, okay? This was a patient that came to my office. She actually had experienced a series of 3 morpheus to the lower buttocks.
Okay.
And it was driven to improve cellulite and to lift.
Okay.
Well, a lot of providers know that morpheus can sometimes, when overdone, can actually affect that hypodermis layer.
Wow.
Which totally takes away that fat from that butt. Well, this is not, you need lift, you need fullness in the buttocks, or you start to look crepey and actually more cellulitic. Well, you can see here what I did on her is I used Radius Dilute and I inject the butt to provide a buttocks augmentation. This is something that I use routinely with any skin tightening, like all therapy, cell sound. What I'd love to do with this patient next is work a little bit on her cellulite with cell sound.
Yeah.
And I just keep it on that skin tightening mode to help improve her texture, not emulsify her fat. And that's the awesome thing about cell sound is we can customize it to her needs, you know? So first thing here, you can see on the left, she's depleted, and to the right, that is an immediate correction.
I mean, it's unbelievable.
Yeah.
Now, how many syringes did you have to use for this?
Oh, I used 21 on her.
Yeah.
So, yes.
And it was dilute, did you say?
It was dilute. So I take a little bit of normal saline. I emulsify that syringe of filler. I know we think filler. Well, gosh, that plumps lips, that plumps cheeks. How do I put that in my buttocks? Well, it's a very different form of technique. And that's why you've got to go to a very credentialed provider that, is experienced in on and off label use and keeps you safe and effective when delivering treatment.
And it's going to last longer, right? Because it's a biostimulant.
Oh, yes.
Yeah.
It's ongoing. Last slide.
Okay.
Is just our summer special. So, you own Regenerative Biologics Institute. We're one of the only people that have cell sound. So join us this summer for our most recent special. We'd love to give you a complimentary consultation.
Yeah, just to kind of see what your needs are, et cetera. We'd love to go over all of that with you guys. I experienced cell sound myself. So has Melissa.
Yes.
It was remarkable. I've experienced old therapy as well, and it was remarkable. So there's some really good devices out there where you don't have to hide away from the sun like a vampire, and just really regenerative in general. Like I said, cell sound is a regenerative novel treatment that we have. So in any event, I'm very excited for it. I love having you.
I know.
I love all your
Next
knowledge.
episode.
I want to pick your brain constantly, and then as you talk, I think to myself, oh, what can I get? That's what I'm thinking the whole time in the background. I'm politely listening, but I'm thinking, what can I get next? What can she do to me? But anyways, I thank you so much. Appreciate you. Thanks everyone for joining us.
Thank you guys.